Now, what are the benefits of multidisciplinary care? So I've already highlighted the importance of accurate pathologic review and staging. So whenever a patient comes to the multi-D clinic, this is an important part of their care so that we have appropriate staging, diagnosis, and the treatment decisions are actually rendered in real time. So patients who may be equally suited to either surgery or radiation, sometimes it's a matter of choice, and we do have better physician and patient satisfaction to address patients' needs because their care is delivered in an integrated fashion and all the disease disciplines are there in one place. So there's also importance of complementary medicine as well as psychosocial care. And we've always known that complementary medicine refers to treatments that are used in addition to standard of care treatments. And we would like to be able to utilize it for mainstream medical care. Now, it is also a very important part of the care of patients with bladder cancer, the overall psychosocial aspect of their care. And with that, I would like to turn to Dr. Lolak to further discuss these aspects.
Okay, thank you, Stephanie and Dr. Erica and Ching for having me today. And hi, everyone. Thanks for joining us. And it is my pleasure to be here today. So as you know, cancer not only affects your physical health, but also your emotional, spiritual, and cognitive health as well. Hence, there's a benefit and a real need for a multidisciplinary approach and supportive care, in addition to the standard medical or oncology treatment that the patient is getting. So evidence suggests that patients with bladder cancer tend to do worse psychologically right after their diagnosis. And this is especially more pronounced in muscle-invasive bladder cancer. Also, patients who receive aerial condyle experience more psychological distress, and this is compared to other methods of urinary diversion. So I want to talk a little bit about depression, which is one of the most common psychological symptoms in patients with cancer. Well, it is a spectrum of symptoms, which may range in severity from non-pathological or normal sadness to clinical syndromes associated with marked distress and disability. So first of all, depression in cancer is very, very common. Almost 40% of cancer patients experience some depressive symptoms at some point in their cancer journey. And there are many risk factors associated with depression in cancer, including more physical burden of cancer, for example, functional disability, or more advanced stage, higher physical symptoms, and especially pain. Also, if you are diagnosed at younger age or having advanced disease when you are diagnosed, then there's higher risk of depression. History of early childhood adversity, loss, trauma, that also increase risk of depression in general and also depression in cancer patients. And social support, the level of social support is a big one. As you know, dealing with cancer is not easy, and the more support you have socially, then you tend to do better than patients who have less support. Also, personal and family history of depression determines your risk of depression after cancer. And in bladder cancer, patients who undergo radical cystectomy tend to have higher risk to develop depression. So what are the impacts of depression in cancer patients? So depression is associated with negative psychological and behavioral symptoms. For example, when you're depressed, you have less motivation towards self-care, including exercise, eating healthy or doing appropriate health promoting behavior. Then it might also impact your beliefs about the treatment. You tend to be more negative and pessimistic, which might impact your decisions about treatment. There's also aspect of social isolation and avoidance of health promoting behavior, healthy behaviors like exercise. And also evidence suggests that patients with depression also have greater difficulty in tolerating treatment side effects. And this can also lead to some of the negative behavioral outcomes, including poorer quality of life, greater physical symptom burden, reduced health promoting behavior, like I was mentioning, which can also impact treatment compliance and medical outcomes. And finally, it can be associated with elevated risk of suicide and desire for hasten death. So what about suicide in cancer patients? Well, evidence shows that cancer patients has an increased suicide risk. The highest rate of suicide happened shortly after diagnosis of cancer. Now, in both general population and in bladder cancer patients, being older, being male, and being unmarried carries the highest risk. And if you have a combination of three of those, then your risk is probably in the highest category. In bladder cancer patients, having advanced cancer and high disease burden likely increase suicide risk. And also in GU cancer, rate of suicide among bladder cancer patients is one of the highest. So according to DSM-5 criteria by American Psychiatric Association, clinical diagnosis of what we call major depressive episode, which is a more severe clinically significant form of depression, requires following 5 out of 9 symptoms. And the symptoms happen for at least 2 weeks. However, one of the symptoms has to be from the first 2 on the list, which is either depressed mood or diminished interest or pleasure. And the symptoms are persistent and severe enough to impact one's function, whether social, occupational, or other important areas of functioning. However, even if you have symptoms that
Dr. Lolak, I believe you might have
Yes.
hit the mute button for a second. If you could go back over, you were just talking about the diminished interest and pleasure, and then you just
I'm sorry.
disappeared from your voice. You must have hit the mute button.
I'm sorry. I didn't realize that. Okay, so yeah, so one of those 2 symptoms is involved depressed mood or diminished interest or pleasure. And like I was mentioning, these symptoms have to be persistent and severe enough to impact the patient's function in one or more areas. However, even if you have symptoms that don't quite meet the criteria, a lot of times you still would benefit from professional support and help with management. So this is the time course of depression as opposed to anxiety for 10 years after diagnosis of cancer, and this is for all the cancer in general. So after diagnosis of cancer, depression appears to be most significant during the first 2 years, and then tend to decrease incidence over time, compared with anxiety, which the rate tends to persist over the course of several years during the survivorship period. So what are treatment for depression? So if the depression is mild or mild to moderate, So we would emphasize what we call non-pharmacological treatment, which I'll talk about in the next slide. And then in some cases, the patients might have benefit from medication treatment. In that case, the majority of patients would benefit from the medication, what we call antidepressant medication. However, antidepressant medication typically takes 3 to 6 weeks for therapeutic effects, so it doesn't tend to work right away. It takes some time. However, if the depression is severe, then usually the medication is required or necessary. However, it's not adequate. So you have to combine it with non-pharmacological treatment. So what are some of the non-pharmacological treatment that is effective in helping depression in cancer patients? So this includes, for example, counseling, talk therapy, or what we call psychotherapy. There are many types of talk therapy, but the ones that has the most scientific evidence is a specific type of talk therapy called CBT, or cognitive behavioral therapy. There's a support group that's available for cancer patients that can help providing guidance, support. And there's the treatment called, or technique called behavioral activation, which is essentially a strategy to force yourself to do healthy behaviors as if you're not depressed. For example, even though you don't feel like getting out of bed or going out or exercise, you force yourself to do that anyway, and then you get the benefit from doing exercise, or going outside, or socializing, which in turn will help improve your mood. Then there's strategy or intervention called mind-body intervention, and Lauren will touch on this more during the next part of the presentation, which this may include a practice called mindfulness, yoga, or Tai Chi. There's self-care, which is a big part of treatment for a lot of symptoms, including depression. Physical exercise is one of the best things that you can do as a cancer patient, and also if you experience some depression. Nutrition, good healthy diet, sleep or sleep hygiene, how to improve your sleep, is also essential. And then lastly, there's an area of spiritual or meaning, whether that means attending church, a group, or journaling, or using art or nature that helps you find and process your experience of having cancer. So unfortunately, in terms of specific studies in bladder cancer patients, there are very, very little studies on the long-term psychological effects or changes, or the differences across age and gender, or across treatment modalities for bladder cancer patients, other than the suicide risk. However, there's some evidence that suggests that treatment options that enable patients to make minimal lifestyle changes or reduce ostomy or catheterization requirements likely will be less harmful, at least psychologically. But then again, there are few studies on specific interventions or preventive strategies. However, we know that not only from other cancer or disease, and also our own experience and other clinical experience, that multidisciplinary care approach helps, because it helps meet the patient's needs and also provide support in different areas. So before I finish with my portion of my talk, I'd like to share some tips and strategies on how to deal with what we call cancer anxiety, worries about cancer, which is very, very common, almost universal challenges in cancer patients, no matter what type or what stage you're in. So this includes, first of all, to really accept it that this is part of the process. Don't deny it. You're going to have some anxiety when you're dealing with something as hard as cancer. You want to create routines and stick to it. And you can do this easier by anchor your day with what I call healthy habits. Usually that means exercise, maybe a walk or some sort of physical exercise daily, or going out and socializing, things that you feel better after you do it. And you want to remind yourself of your priorities. What is meaningful for you? Focus on things or people or issues that are high on your priorities, and let go of things that are lower on your priorities. Focus on short-term goals, things that you can work on over the next week, next couple of weeks, or next month, or next couple of months. But also keep track of a long-term goal so that you don't lose sight of it. And then find helpful distraction strategies. But distraction by itself, is, even though it can be really helpful when you're having a lot of anxiety, but you also want to find time to process, to make sense of the experience of having cancer. This may include journaling, or talking with a counselor, or talking in a group, or reading cancer memoir or art, using meditation as a way to make sense of your experience. And then lastly, you might consider developing personal practices to help lower your stress and to be in the present. For example, exercise, physical activities usually help. Mind-body techniques, like I mentioned, yoga, tai chi, gratitude practice can be a really powerful practice, easy to do. And also mindfulness practices, like I mentioned. So this concludes the part of my talk, and I'm going to hand over to Lauren.